Hello, I'm Joan Justice from HealthWorks Collective, and I have with me today Dr. Nick van Terheyden from Nuance. Dr. van Terheyden has a background in medicine, information technology, and speech recognition, and is Chief Medical Information Officer at Nuance HealthCare Solutions. Nuance develops medical voice recognition software that helps increase the quality of documentation, improve efficiency for healthcare professionals and providers. Dr. van Terheyden, tell us a little bit about Nuance and what you do to raise the quality of care.
Well, hello, Joan, and thanks for the opportunity to join you. It's always exciting to be in these virtual exchanges, and thank you for those kind words. As you described, Nuance, a large organization, I think most well known for its technology in speech recognition. I think Dragon, naturally speaking, is probably the product that most people would associate with the company. But as an organization, multi-billion-dollar with many different sectors, healthcare is about half of what we do. But the balance of that is all of the things that you interact with. So when you call up the airlines to get flight information or to interact, that's our technology typically that's working in the background. When you're in your car and you're interacting with the car systems, vSync and some of those other applications, those are our systems as well. So we have a range of different products. And what's exciting about that from a healthcare standpoint is all of the research and development, and we spend somewhere of the order of $160 million per year in research and development, doesn't just benefit those areas, it benefits healthcare as well. One specific example that's kind of interesting, when you're talking to your car, that's a very noisy environment. All of the research that's gone into making that effective and work has been transferred into the healthcare arena. And, you know, specifically in the ED department, very similar to talking.
Sure.
You know, we've worked out how to sort of filter out those things and make the voice more effective. In the healthcare space, I think we're very well known for both our back-end transcription solutions that support transcription and automate that to improve efficiencies. And then obviously Dragon Medical, naturally speaking, that's implemented. Somewhere of the order of 400,000 clinicians are using our technology in some form or another, either using back-end where they dictate into a phone or some device, it gets processed, somebody else is involved in reviewing it, that's a transcriptionist or an editor, and then it gets returned and they sign off on it. And then the interaction that we have with systems, and we voice enable them using Dragon, allow people to dictate. More recently, we've introduced a number of other tools that give you much more flexibility in that exchange. So we started to introduce sort of mobility solutions, so you can start to use mobile devices to dictate. So everybody's liking these devices, but the challenge has been, how do I get an easy interaction to capture information? Sometimes the keyboards on these devices represent a challenge, even with the bigger ones. So voice sometimes proves to be a very useful tool in there. And then the other thing that I think has been really important in terms of elevating the standard of care and starting to introduce tools that facilitate clinicians and help patients get more value from this has been the intelligent voice systems that essentially allow you to interact with technology and smooth out the complexities. So many clinicians complain about the difficulty of working with an electronic medical record. It's a very complex environment. Finding the lab results might require you to go to a specific menu, select a patient, and so forth. And what we find is that for some people, and it's not universal, but certainly for those that are struggling with that, and you know, remembering the command to say, show me the lab results, can be easier. And with intelligent voice systems, what we're doing is turning that on its head and saying, rather than you having to remember that it's that specific sequence, you can do it any way you want. Show me the lab results. Show me the latest patients. What are my patients today? Any one of those variations ought to produce the same effect. So all of the synonyms are sort of accounted for. And what we do on the back end of the technology is we understand what they said and we interpret that and action that so that they don't have to learn some of the technology. not always appropriate, but from the perspective of mobility and being out and about, it offers you more flexibility than working with a keyboard, which can be quite challenging in these small devices. We can look at the information, but then how do we interact with it? And then how do we actually capture that information? So if I want to enter data or to interact with the system and, you know, provide some of my medical decision making, that can be difficult on a keyboard on a small device, but I can voice it, understand it, and then use that for additional functions downstream.
Okay, what are some of the patient benefits to this? I can see where it might be very beneficial to patients. Talk a little bit about that.
So patients, typically have struggled with technology because it has defocused the clinician away from the interaction. So, you know, one of the things that we hear repeatedly is when they go into a physician office, they're frustrated by the challenge of the technology detracting from the interaction. Right. So I'm dealing with the keyboard, I'm dealing with the screen, whereas they want me to be focused on them. And I think one of the key facets of this is that intelligent voice systems can start to listen into that exchange. So as we interact as a physician-patient, you're explaining your conditions, you're talking about my challenges, I'm having difficulty walking upstairs. We listen into that, we listen into the physician, and we're starting to use some of that clinical understanding technology, extracts out the information, and then we can present it back to the physician and to the patient for review. Does two things. One, it allows me to focus on you. I think from a patient satisfaction, that's going to increase the level of satisfaction and patients' interaction will improve. And number two, it makes that information much more readily available, not just for the clinician, but also for the patient. And I think we're seeing more patient engagement, and delivering that quickly to them is a key part to this. You know, there's no waiting for this for hours, days, sometimes weeks to receive it. I want it now. So
that's excellent. And can it eliminate transcription, do you think, or will it eventually?
Well, so, I would say that it's, transcription is dead, long live transcription. I think we've been predicting the demise of transcription for a long time. And I think what transcription has done over the course of the last several years has been morphed into a different role. So it's much more of a supportive role. And I think the key to success of any voice systems is delivering choice to clinicians and to patients. And choice is sometimes I want to pick up, dictate, and hang up and be done with it because I'm so busy. Perhaps my colleague is off sick with the flu. I can't cope with the patient load because it just doubled for me suddenly. And it's much quicker for me to offload that to somebody and review it. That's really a back-end process. We still apply technology. We can still do all the intelligent things, but it's a little bit delayed. But there might be another time when I'm not as busy or it's a patient on the weekend. I'm interacting with them. I want to get that report so that they, when they're admitted to the hospital as an urgent care case, that information is transferred immediately. So I'm willing to interact with the voice system. So I don't think we'll ever see transcription disappear entirely. I think what we'll see is it will morph into this supportive role. And we've already seen that with some of these scribe solutions that have editors working in conjunction. So I think transcription will continue to persist in some form, but maybe we should change the name. We changed them from transcriptionists to editors. I think they still contribute tremendously. Their value proposition changes, and technology will just make them more efficient, as it did with back-end. They're going to become more efficient. They might morph into a different role as part of that interaction.
All right. Well, thank you so much, Dr. van der Heijden, for explaining more about voice recognition software and what it can do in the way of raising quality of care. Thank you so much.
Joan, thanks for the opportunity. It's always a great pleasure to chat with you. Thanks.